Americans. And I want to thank all of you for coming out today. We're here to honor Congressman Critz and endorse him. The Alliance has given an endorsement for Congressman Critz. He is one of our heroes. When I first met Mark, he promised that he would keep Social Security, and he's definitely kept that promise with us, all of us. So he's one of our heroes. I'm a retired steelworker from Western Pennsylvania. I'm also president of the retirees at the Clairton Coke Works. I'm proud to be here in support of an honorable young man, a supporter of seniors, and great Congressman Mark Critz. Mark has shown Pennsylvania seniors what he's made of, and we're proud to stand behind him. Mark has proven time again that we can rely on him to protect our interests. He's the one we trust to keep health care affordable for seniors, work to strengthen retirement security, and future generations. It's no wonder he has a 100% score with the Alliance for his pro-retiree record. There aren't too many 100% in our voting record.
This is an easy one for me. When it comes to Social Security and Medicare, Social Security was created so that senior citizens wouldn't be going into the poorhouse because they had no way to pay their bills. Medicare was created because Social Security, all the money from Social Security was going to pay their medical expenses, and something had to be done. And it's all nice, you know, sometimes you hear folks on the other side say, well, that's up to the churches and to the communities to step up. It's too big. If the churches and communities could do it, they would be doing it, but it's too big. So the government stepped in, created Medicare to make sure that our parents, our grandparents, our aunts and uncles could live their retirement years with some dignity. And now what you see, and I believe this wholeheartedly, the Republicans are trying to put Medicare in a position where it will wither and die on the vine. And then it's all back in your lap again. And we cannot let them do it.
Mark's our champion in Washington for Social Security. He stood firm against privatization, the risky scheme that would let Wall Street gamble with our retirement security, and they're really trying. He offered a common sense amendment to take Social Security out of the budget process because Social Security has its own income and expenditures that do not come in or go out through the federal treasury. It does not contribute to the deficit, so Mark knows it should be not part of any deficit reduction plan. He is firm against raising the retirement age, a benefit cut for future generations that is unfair to those Americans who do physically difficult work, and I'm sure there are a lot of you in this room today that would hate to have to work until you're 70. But Mark has done more than just stand against those who try to attack Social Security. He's also co-sponsored legislation that would improve the program for seniors. Mark supports changing the COLA formula to one called CPIE. It stands for elderly. It takes in consideration the health care costs that seniors are all facing, and they're going up immensely, especially right now. The new formula would calculate cost of living adjustments based on the kind of things that we seniors spend our money on. It would give less weight to the price of gas and more weight to the price of medicine. This stands in stark contrast to the Simpson-Bowles plan to initiate the chain CPI, which would weaken our Social Security COLA every year.
I've said all along that how important Social Security and Medicare are to me because I know how important they are to the people in this room and the people across this country, and that I would remain steadfast and stand strong against any attempts to weaken the programs or to change them so dramatically that it really ends the program. And when you were going through, Gene, through all the litany of the things that the other party has thrown out just over the past couple of years, you know, you lose track of all the different ways they've tried to insidiously change the program. And the chain CPI was...
Mark also protects our quality of life by defending Medicare, and it's certainly under attack. Mark rejected the Paul Ryan plan that would turn our guaranteed Medicare benefits into a voucher program, creating a costly headache for seniors. We don't want more confusing choices to make. We're getting into the period now where we're going to be making some more. We just want a program that covers all of our basic care, wherever we are and whenever we need it. The Ryan plan would also force seniors to pay more out of pocket than the current system, according to every study done on that plan. Mark the right vote on this plan twice. Mark cast the right vote on this plan twice. Mark voted against efforts to increase co-pays for preventive services under Medicare. He understands that these services saved money by keeping us healthy. He also fought Republican efforts to do away with the new discounts on prescription drugs that saved Pennsylvanians $156 million in 2011 alone. They even want to permanently reopen the donut hole in Park D and make it bigger than ever. Mark was on our side instead. Finally, Mark ignored the rhetoric about phantom Medicare cuts that actually reduced wasteful payments to insurance companies and added years to the life of the Medicare trust fund. The Affordable Care Act has actually extended the trust fund life of the Medicare for 8 years, so we're going in the right direction, and Mark, you're helping on that. Thank you very much.
And the difference between the two plans is that increased costs in the Republican plan will be borne by you. That's it. If costs go up, you're going to be responsible for it. In the Democratic plan, if costs go up, it's going to be up to the insurers, the health insurance, and the companies, the healthcare providers, to bear those costs. And the goal of both of the programs is to lower costs, except the Republicans want you to bear that burden. So you know what happens, and what's going to happen, and what they're trying to make happen is it goes way back to what Newt Gingrich said. He wanted Medicare to wither and die on the vine. And that's exactly where their program wants to take this, is that it puts it into your lap, and if costs go up, you know what happens? You don't get more money. That means you get less care, because you can afford less. And that's their plan, to put it in your lap. And it's frustrating to me because, you know, you hear all the rhetoric out there, and they're all saying, oh, we're saving Medicare, we're saving Medicare. Well, you heard what Gene said. The plan that exists right now, that's been declared law and constitutional, extends Medicare for 8 years. So it's doing the things that
It's
we...
with great pleasure that I, on behalf of the Alliance for Retired Americans, our 300,000 members and 146 local affiliates across the Commonwealth, and our 4 million members nationwide, endorse Mark Critz for Congress. Thank you, Mark, for all you do for seniors. We will do everything we can to make sure they know it in November.